Welcome to Talk Me Healthy. My name is Sherry Keating, founder, Diabetes Care Consulting. The goal of Talk Me Healthy is to provide you education on how to live your best life every day starting today. Each show will bring a different health-related topic and exciting guests to share their expertise, passion, and personal stories. My hope is you will hear something that motivates you to make a small step towards living a healthier, happier life. Welcome to Talk Me Healthy. This is Sherry Keating, your host. Today's show is going to be on complementary care and integrative medicine. And I have as my special guest my friend and colleague Lynn Gerrits. And Lynn is from the Simonds-Hurd Complementary Care Center at Burbank, at the Burbank campus in Fitchburg. So welcome, Lynn.
Thank you, Sherry. I appreciate you having me here.
Oh, you're welcome. That's a mouthful to say.
It is.
Complementary care center is much easier.
And it's even worse when you say UMass Memorial, HealthAlliance Hospital, Simonds-Hurd Complementary Care Center.
Exactly. So is that the official name?
Yes.
Okay. All right.
Yes.
Well,
we're part of the UMass system.
Okay, great. So thank you so much for coming on today. And I'm excited to hear all the things that you're doing for patients in the hospital, patients in the community, patients in the both campuses. So before we get to that, tell me a little bit about yourself and how you ended up in this field.
Well, it's an interesting story.
Okay.
I'm actually a master's level counselor. So I was doing counseling for years. And during that period of time, my husband actually had tonsil cancer. So he was treated up in the cancer center at Fitchburg. So at the time, with my counseling and everything, I was teaching a lot of stress management, doing Reiki, a lot of holistic techniques, and that was helping him and my family through, the journey of cancer, helping us navigate that and stay strong and resilient and everything. At the time, I actually thought I had to go back to nursing school to run a wellness center. I wanted to run a wellness center, so I actually started to look into that, left my job as a counselor, became a CNA.
Really?
Yeah. And in the meantime, I was talking with one of the social workers at the cancer center, and I said, you guys need like a complementary care center. People need resources like this to help them as they're going through cancer treatment. And they had just got some money to build a complementary care center on the Fitchburg campus. Wow. And so I got invited to be on the advisory panel, and then I got invited to run it. And so it's a labor of love and a passion for sure.
Oh, that is wonderful.
Yeah.
And how is your husband doing?
He's doing well, thank you. 11 years cancer-free. Yeah.
I actually used the Complementary Care Center when I was going through cancer myself for some acupuncture. And I'm not a fan of needles myself. So, but you know what? It really was helpful.
Yes.
It really was.
Yes. And that's actually one of the things that I'll talk about is some of the services that are available there that, I wish they were there when my husband was getting treated.
So tell me about the cancer, the Complementary Care Center and the services and what you've done since you've started this.
Sure. I'll actually back up a little bit and kind of dispel some of the terminology that confuses people.
Okay, great.
There's the alternative, complementary, and integrative words that are being used. And so let's start with alternative. That actually means you're either going to your doctor or you're getting acupuncture. It's one or the other. And we don't subscribe to that notion at all. We definitely want to do everything together. So that word is kind of not being used much anymore. We're not giving green juice away or, anything like that. So the complementary word, which of course our center has in its title, was used because it's used in addition to, so not to be confused with free. Believe me, a lot of people think that.
Oh, really?
But it's in addition to your traditional medical care, but there too, someone can maybe get acupuncture and see their doctor, but they're not telling their doctor that they're getting those services done. So, and there are some definite physiological benefits of the services that we offer that the doctor should know about because meds might need to be adjusted, like pain meds, for example.
Okay.
So that term is even kind of going away and being replaced with integrative. So integrative means you're working together. maybe not necessarily side by side, but you are communicating or hopefully communicating with medical providers and specialists. They're all talking together, sharing patient information with the patient at the center to make sure that the treatment is as holistic as possible. We're caring for mind, body, and spirit, and we're also thinking outside the box in terms of non-pharmacological options for pain and symptom management. So that's where we're at now. We're kind of really pushing the tide to think and behave more in terms of integrative. And with the Cancer Center, we've been actually working that way for about 6 or 7 years now. So when the Complementary Care Center opened in 2010, about a few months into it, I started a Reiki volunteer program right in the Cancer Center. Again, labor of love. So I was able to get that program in there so that patients could have Reiki available to them at no cost. And then within the year after that, found a grant that we've actually had ever since that allows us to provide acupuncture, massage, we've done yoga and music for free for the patients as they're going through treatment, with the whole idea that it's non-pharmacological symptom management. So people don't use another pain medication, or maybe they don't use a medication that will help their peripheral neuropathy, the tingling and numbness in their extremities. A lot of patients these days are very, very savvy. They don't like the idea of too many medications, especially those patients going through cancer treatment. They're already getting chemotherapy and other symptoms, other medications to help along the way, but they have some side effects too.
Right.
So acupuncture helps with pain, peripheral neuropathy, nausea, vomiting, fatigue, hot flashes, xerostomia, which is if a head and neck patient is getting radiation, their salivary glands dry up. And so it's very hard for them to swallow. So they get sores in their mouth, which is the mucositis, and so acupuncture helps those things.
And so as part of what you're doing with the Cancer Center there, does a person have to be enrolled in the Cancer Center having their treatment there in order to benefit from this? Or is this something that anyone in the community can call you and say, I'm going through cancer treatments at UMass or in Boston, can I benefit from this?
So 2 separate things. The grant is actively in the Cancer Center. So yes, the patient, they need to be a patient, either infusion patient or Cancer Center patient. The caregivers also get the benefit too. They just can't use acupuncture, but they can get a chair massage or a hand massage or foot massage.
Nice benefit,
well, they need to be taken care of.
Exactly.
Absolutely.
Exactly.
The stress is enormous. So when they are being treated in the Cancer Center, all of those services through the grant are available to them. Okay. But to your point or your question about, say, someone's getting treated somewhere else, can they benefit from some of these services? Yes, they can, just not through the grant for free. They can come down to our Complementary Care Center, which is the floor below it. Okay. And that would be a fee for service out of pocket. Sometimes insurance might cover acupuncture, massage, flex spending could cover it, or they can get, family members or friends can purchase gift certificates. A lot of people do that, when they know someone's going through treatment and they're like, what can I do?
That's a great gift.
They buy a gift certificate for whatever they want to use it for in the Complementary Care Center. So they get $10 off, and we do have a little bit of funding to help decrease costs for those who have that the financial challenges there.
And how about getting there? Is there any programs? Sometimes that is an issue, transportation.
Absolutely.
So is there any programs available for people to get to the center for these wonderful, different types of complementary care benefits?
Well, we are on the bus route. So the MART is, drops people off right in the front of our center. So I do know that much is there, and if they're a cancer patient, they could arrange for transportation. Those are about the only details I have around that.
All right. And what other services besides? I know you offer acupuncture, and you offer classes, or tell me what else is available to people.
So in the center, which is beautiful and spa-like, by the way, it's people talk about just walking through, and they're like, oh my gosh, you just forget you're in the hospital. It's just so soothing and relaxing, and the energy is very, healing. So we have acupuncture 4 days a week.
Okay.
We have massage almost every day except Sunday, I believe. And massage, we have oncology massage. So one of our therapists is specifically trained to work with cancer patients. She's also trained in muscle release technique, complete decongestive therapy, which is lymphatic massage. But we also have a physical therapist trained in that as well in our PT department. We have a massage therapist who's trained in prenatal and postnatal. And the other one is also trained to work in a hospital as well. So we've worked in maternity, for example, providing massages for new moms, which has been exciting. And then we have a plethora of yoga classes. I teach all the Reiki level classes. I teach stress management. We have a strength training class for women who have gone through, and men who have gone through breast cancer. So it's, trying to get past, the challenges that maybe surgery has presented, the range of motion limitations, things like that. I also teach essential oil classes, aromatherapy. I'm finalizing my certification in aromatherapy. We'll be starting an aromatherapy program in the hospital to help with our patients.
So do they make their own products? Or
in those classes, yes. So it's for fun. They learn the safety of it. So a lot of people are using essential oils nowadays without knowing what they're doing.
Exactly.
So there's a lot of companies out there, and it's everywhere. You look in Target or anywhere, you find essential oils. You don't know anything about the quality. You don't know how to use them, what's safe. And there actually are a lot of contraindications for meds that people are on and medical conditions that people have.
Pets.
Oh, and pets as well. Absolutely. Ages. Absolutely.
Because I actually am a consultant for Pure Haven Essentials, and we have a line of essential oils. And when I go to a class and teach about toxic chemicals and we make our own non-toxic products with the oils, I tell them you need to be educated to use oils because they're not just across the board safe for everybody. And I so definitely I love the fact that you have that. I may even take that class.
September.
Okay, cool. That's great.
So in addition to the things that we offer there in the center, and the classes are always changing, and we have a newsletter, by the way. It comes out quarterly. And so the newsletter has 3 months worth of our class schedules in there. So people can get on the mailing list for that. They can pick them up over at the hospital on either campus. So that's always helpful. And we have a website, Simonds-Hurd.com, that they can reference all of our class schedules, bios on our providers, their information. Because all of our providers, by the way, are contractors. So they're not employees of the hospital. So I really want to mention that because people might think they can call the main number and say, I'd like to schedule a massage. But they have to schedule it with the massage therapist directly.
Okay, that's
so
great.
That's important.
Okay, that's good to know. All
But in addition to the center, so we're working really hard to integrate into the hospital to really make some of these services available to our patients. So like I said about integrative medicine, that's the idea. We want to be working side by side. So in the cancer center, we've really got a wonderful program there. Our nurses and our physicians make referrals. Like, for example, our radiation oncologist, whenever he has a head and neck patient who's going to be starting treatment, he's like, I want them starting acupuncture first. Right away to prevent to heal, like to protect the salivary glands. Then we have nurses who are wonderful advocates and, will advise a patient, you might want to think about massage for this. You might want to think about acupuncture. Have you tried Reiki? They're wonderful, wonderful advocates for it. So that is a very, integrated program, and it's running like a well-oiled machine. It's doing very well. So over on the Leominster campus, though, there's a lot of opportunities. So we have a wonderful palliative care department. So actually, the nurse practitioner in palliative care and I are close friends, and she is a massage therapist herself. So she will often call me to go over and, maybe give a hand massage to a patient, do some stress management, maybe some breathing techniques, some guided imagery. We have a beautiful harp. It's called a reverie harp. We have 3 of them for the hospital. And they're, oh my gosh, they're beautiful. They're tuned to the pentatonic scale. So you strum it and play it. Anyone can do it. It's just so beautiful. So we have Reiki volunteers over there. I've been teaching hand massage. Various staff and volunteers can learn that. We've got the music. We have a new crew coming through, both of Reiki volunteers and more musicians coming through who can help to really make our patients feel more comfortable because, of course, as you know, as soon as they walk through the door, they're anxious.
Absolutely.
That's across the board, without doubt, everyone there is anxious. Yep. So how can we help them without a medication feel a little bit more relaxed, maybe help reduce their pain, maybe help with their nausea, say, for example, ginger aromatherapy. So there's different ways that we can help them, and we help our caregivers. So integrative medicine isn't just about the patients, but about our caregivers, the people providing the care who are so stressed. And a lot of times people don't have their own good self-care practices. So I'll work with our caregivers to teach them some of these techniques, whether it be Reiki or hand massage or breathing techniques or mindfulness meditation, so that they can take care of themselves and walk the talk, and also maybe have some skills to use with the patients or the family members.
So how do you do that? Because I've been in the system for 35 years. I've never seen these classes offered. So how do you, is it you go to a unit and teach them like in an in-service, or how do you do this?
It's kind of upon request. I've taught, for example, the Executive Nurse Council, so I've probably trained close to 30 nurses who are interested in learning hand massage. Our CEO was there as well. So I will, if a unit says we really need some stress management, so we'll schedule a 3-week stress management series with that unit. So it could be, provider accounting, it could be a nursing unit, it could be whomever wants it, and I can provide that for them.
And you do that as part of your job?
Absolutely.
Oh, yeah. Well, I'm going to think about how we can get that to where I work. Because that sounds great. You bring chair massages and everything too.
Yeah.
You do?
Yeah. Well, chair massages, that's, kind of a fee-for-service thing, because like I said, our massage therapists are contractors.
Oh, that's true. But the hand massage.
Yes.
And the Reiki. And are you working with newborns?
Yes, we are.
I saw that in there. So tell me about that.
So we actually, unfortunately, have a high population of babies who are born to addicted moms. It's called neonatal abstinence syndrome. And these babies are very hard to soothe, and they tend to stay in the hospital for a longer period of time until their scores settle down, until, the moms can take them home and they're weaned off whatever it is in their system a little better. So what we are trying to do is to add some of what we do into the mix as well, so that maybe the baby can be discharged a little sooner, and to give mom some tools to work with as well to help soothe her baby. So Reiki is part of that. So, and that's simply holding the baby and offering Reiki, the aromatherapy piece, and the harp music.
Oh, that sounds so good. And those babies so need that.
They do. It's really sad to see them.
I'm sure it is. But you're doing such a great service for them. And
we're trying.
Yeah, it sounds like you guys are doing a lot of good things. And with the opioid crisis, I did a show on that last month, and shifting away from medications and offering this type of healthy way to deal with pain and stress and anxiety is going to be very beneficial for that population as well.
Exactly.
And do you offer, is that something that someday maybe that will be in some of those recovery centers for?
Well, there is. I know Recovery Centers of America up in Westminster is a holistic program. They have an integrative program.
Oh, that's great. So where do you see this center moving from here?
Well, and it's, it's more than the center now. It kind of started just as the center, and it's moving to become an integrative medicine department for the entire hospital. And of course, now that Clinton is part of HealthAlliance as well, there's opportunities there as well. So, we're kind of exploring starting a yoga class over there, offering some massage, the Reiki volunteer program we could easily put over there, the hand massage volunteer program, teaching staff the way I'm teaching staff over here. Same opportunities. So it's just kind of expanding. I've actually already been down to Worcester, and I've been teaching some of the caregivers down there as well.
So that's great that it's going to fan out to all of the entities under the UMass umbrella,
little by little,
so to speak.
Kind of planting my seeds.
Right. And with the new Epic system that's coming,
yes,
the physicians will also be able to see you. I am assuming that you'll be communicating with the physician. So you're really integrating it as well in the new charting system.
Correct.
Called Epic.
So all of my providers, the acupuncturists and the massage therapists, will be going through Epic training. So they will be inputting their information into the electronic medical record. And, the great thing about Epic is it's one patient, one record.
Right.
So that anybody can see that, oh, this patient had acupuncture. Oh, this patient has been getting massage regularly. So that might mean that, how is your pain being managed? Maybe we can cut back on your pain medication or your Neurontin for your peripheral neuropathy and things like that.
So how do you determine, besides the patient saying, yes, I feel better, is there studies? Are you tracking the information of the benefits of what you're providing to the people that you're providing it in terms of doing outcome studies or anything? Or is this just based on they need less medication, or they're telling you verbally that they're using less medication, or that, they feel better? So scientifically,
It's a little bit of everything.
Okay.
So from day one, and I'm one of those people who said, I don't want to be kicking myself out after the fact down the road, like saying, oh man, I wish we collected that information.
Right.
So from day one, even with that Reiki volunteer program back in 2011, I had developed a form. So we track things like pre and post pain, pre and post anxiety, things like that. We've been gathering patient testimonials all of these years, in which the patients are telling us, I haven't had to use this prescription, I'm walking better. We've had a patient who was receiving chemo, and it was the type of chemo that really made the peripheral neuropathy really bad. He was a fly fisherman. He couldn't even button his shirt, let alone tie a knot in the fishing line. He couldn't even sign his name. While he was still going through treatment, the acupuncture actually helped relieve his peripheral neuropathy to the point that he was able to do all those things. So those testimonials go a long way.
Oh, absolutely.
But we are collecting the data, and should we have someone who wants to help us make sense out of that, as opposed to just kind of rolling in the numbers a little bit, that would be great too.
That would be interesting to see.
Yeah.
Validation.
Anyone
out there want to do this, get a hold of Lynn. Because it is a very time-consuming, tedious job.
It is.
But the information would be fascinating to see. But you are validated by what people are saying and by what you can physically see, what's going on with the person. So that is wonderful.
Yeah. And then we're also I teach stress management in our cardiac rehab and pulmonary rehab program, and just recently started doing laughter yoga with our pulmonary rehab group.
Now, personally, since I'm a diabetes educator, do you see a lot of diabetics going through your Center for Neuropathy? Because I don't think to offer that to them, but now I will start actually.
Awesome. I like that.
Yes.
I can't answer that. I would have to ask the acupuncturist, if they've, because we do take that kind of an intake so that it would be on that form. But I would have to look at the data and call through that. But that would definitely be a wonderful opportunity for patients to come through and get some relief from that.
Is it I don't want to put you on the spot in terms of monetary, because monetary value, what the benefit is going to far exceed the monetary value. But for some people, it's a concern.
Of course.
So is it manageable? Does insurance, how you have that health benefit on your insurance? Does that apply?
Yes. So, yes. Finances are always an issue, and people think of a lot of these things like massage as a frivolous thing, like, oh, I don't have any money this month for massage.
Like it's an extra, not a need to have, but it's a want to have sort of service.
But with integrative medicine and with holistic health, people really need to understand that. It's kind of like, would you, not take your pet to the vet? Just because you can't swing it. You want to keep your pet healthy, so you know that there are certain things you need to do to do that. Or would you not do the regular maintenance on your car? Well, you need to rely on your car to get you from A to B, so you wouldn't forego that kind of a maintenance. This should be thought of as in the same way.
So the whole body, the mind, body, spirit as one.
Exactly. So things like flex spending do cover acupuncture and massage. And we don't take insurance, but what we have found is that because some insurances do cover it, we just don't bill for it. But because, say, they cover it, people can come in, they pay out of their pocket, and they sometimes can get reimbursed with the paperwork that they submit. Okay. So an intake for acupuncture, first session would be $70. Subsequent private sessions would be $60, but we have a clinic, $30 a visit, or buy $400. So it brings it down to the cost of a copay. And if you're typically going twice a week for acupuncture for a couple of months, and then you wean.
Okay.
Yeah, you kind of cut back. So it's not like you're always having to do it. That's the thing.
And if you have one less Dunkin' Donut coffee a day, maybe at the end of the month, it all adds up.
Exactly.
And you're doing such, keeping your whole mind, body, spirit healthy, which really decreases future risk of disease.
Exactly. Because a lot of these services, as good as they may feel in the moment, and you may find yourself, for example, being pain-free, to the holistic point about mind, body, and spirit, a lot of these services, most of them actually do release serotonin in the body. And so these are our natural, mood stabilizers or relaxation hormones or neurotransmitters. So it initiates that relaxation response. And a lot of people don't do that. A lot of people kind of just run around, and our stress is kind of way up here just constantly, and they don't know how to initiate that relaxation response. So these services invite that, encourages us
I
to
love
breathe
that.
deeper. You
Yeah,
know?
that's great. And it's so interesting you say that, because sometimes you don't even know how stressed you are until maybe you go to one of these classes, and then you're like, wow,
Exactly.
I had no idea. And then it really, you start to pay attention to that.
And it's
So
awareness.
it's an awareness.
Absolutely.
It really is. So it's even worth it to try a class to see really what state your body is, because
Absolutely.
stress does trigger disease.
Very
Absolutely.
much so. And accentuates it.
Absolutely.
Yep.
Yeah.
So it's, we don't need to live going through our lives with managing illness.
Yeah.
We can actually reverse, as you know, with diabetes, for example.
Yeah.
We can reverse some of it, or at least, minimize the effects of it on our lives and live a life that's more fulfilling.
And like I always say, with my patients, live your best life today, starting today. And that is a great way to add to healthy eating and exercise, stress management, and all of these wonderful programs that you're offering.
Right.
So if someone was interested in actually going to your center for one of these services that you offer, can you share the number? And we will have more information when the show is on either my website, diabetescareconsulting.com, or on Sterling Lancaster Community TV on their channel. But if you want to give out that phone number for people that are listening,
Sure.
and then we will have also it on the show.
Be happy to. So the main number at our center is 978-665-5800, and the website is www.simonds-hurd.com, and that's SIMONDSHURD.com.
Perfect. Well, Lynn, there's so much we could talk about, because I love the work that you're doing, and I love the fact that as myself, I followed my passion, and I'm doing what I love to do for the reason that I'm doing it, and that's because of my own story. And I love the fact that you got into this and have made this incredible program because of your story and your husband's story and your passion. And so I love that. That's wonderful, and continue to do great work, and congratulations on everything that you're providing for all of our patients and family members in the community, as well as the hospital.
I'll keep going.
I know you will. That's wonderful. So I just want to say again, please utilize these services. It will change your life. And you have the phone number. Call, make an appointment, try it. Open your mind to integrative medicine, complementary care, and reap the benefits. Absolutely. So I'm going to wrap up for this week, but I want to again thank Lynn.
Thank you.
And next month, tune in, because we are going to be talking about Parkinson's disease and the Moving Day event in Boston coming up. But until then, this is Sherry Keating from Talk Me Healthy. Remember, live your best life every day, starting today. Thank you for tuning in. Have a good day.